Hey, good weekend to you. Welcome to Leading Edge. I'm Jerry Anderson. Good to be back with you all. So here we go, folks. Roll up your sleeves. Anybody now 16 and up can get the COVID-19 vaccine this week. So is this home stretch or maybe not? How prepared are we in terms of supply and logistics to meet what we think will be a big demand? Or will it be? This is the younger set after all. Well, to start us off today, I want to welcome in my guest, Dr. Johnathon Ross, retired doctor, internist by profession, serves as president of the Lucas County Board of Health. Doctor, good to see you again. Is the way the public responds now in the days and several weeks ahead of us going to dictate what level of normalcy we return to in 2021?
I think absolutely, Jerry. I mean, the more people that go out and get vaccinated, the quicker we're going to get back to something resembling more normal life. We've got to remember that this virus is mutating. We've got some new variants that are out there. I think for the next 6 months, perhaps, we're still going to have to mask up. We're still going to have to maintain some element of social distance. But as more and more people become immunized and less spread in our community, we're going to be able to at least get together in small groups with other people who've been vaccinated and feel relatively safe.
As we talk, Dr. Ross, this weekend, people are watching us on a weekend come Monday, all comers, 16 plus. How many doses sit chilled and stored, waiting for willing arms starting really tomorrow, Monday?
Yeah, well, we're working toward being able to do a massive number of people at a time. We're talking maybe 5,000 health department, mass vaccination clinic, 5,000 people a day. So, and the vaccine is coming in larger quantities. The main restriction in the past has been the quantity of vaccine, and that's easing some. We're seeing more and more vaccine becoming available to us. So we're pretty confident we're going to be able to do multiples of thousands of people a day at our mass vaccination clinics.
That is really.
There'll be a need to get an appointment and those sort of things. Although we are going to do, you all come. You show up, we'll find a way to vaccinate you, sort of clinics as well. So.
And we all know the propensity for young, healthy people to say, "Hey, look, I'm not going to get this stuff, and if I do, I'm young. Look around; it'll be like the flu, like the cold." To a certain extent, I guess they have a point, don't they? But how do we turn that into willing vaccine recipients?
Yeah, I think it's a challenge. We know, first of all, there's a small percentage, maybe 10-15% of the population that won't take any shots.
Yeah.
So that's an issue. They're just anti-vaccine and, not based on any science. It's either, maybe sometimes distrust of the medical system, we haven't really earned their trust, perhaps. You've got another group of people that are kind of in this wait and see category. And make sure that the people who get the vaccine don't grow a third ear in the middle of their forehead or something. So we've got these sort of concerns. But I think the way we talk with younger people is to explain that although we may not be worried about them dying, they can still get pretty sick. And we know that some of the people who get sick for a long time. And we know that some of the people who get sick get some very annoying symptoms, that are persistent. So I would say, first of all, you have more than just dying to worry about. Second thing is what about, you got parents, you got grandparents,
you can spread it to them.
Them or be around them if you're not vaccinated, because you'll be a risk to them, because you can carry this thing asymptomatically and bring it right to grandma, and that could be the end of her.
Dr. Johnathon Ross, my guest, for these vaccines to accomplish what we hope they will accomplish, we need what kind of participation? And my question to you at this point, have we gotten that locally? I mean, even among the more senior set, most vulnerable people who went first?
We've been pretty good at it because we targeted seniors and vulnerable people first, who are the most likely to get in the hospital or die from this virus. We've got pretty high vaccination levels in Lucas County. We've done pretty well with that. Some of the age populations above 60 were above 70% vaccination rates in those populations, which if they were all staying with each other would be herd immunity. But this goes back then, okay, so they're protected somewhat, but we're not completely protected as a community until our vaccination rate is 70% across everybody. And then it becomes harder and harder for this virus to spread. And the more people that are vaccinated, the less spread there is, the less likely it is that we'll see mutations or variants that could be resistant to the vaccinations. Trying to get this done quick, if we can, and getting everybody to participate if they will is a really important thing. So they can't just be thinking about themselves. They got to think about the other people around them in terms of their obligation to get a vaccine.
You mentioned it, and I guess we knew it was coming. The word variant. I'm less than a couple minutes in here, but are we wringing our hands over this? Are we pulling our hair out? Are we saying we think we still got this?
Yeah, I think that for the UK variant, which is the most common one that is going around, that was originally seen in Britain, it looks like the current vaccinations we're giving are effective against it still, even though a little bit less powerful. They take the antibodies and dilute them down to see how far can they dilute them and still have them be effective against the virus. And there's some reduction. You can't dilute it quite as much and still get an effective hit on the virus, but it should handle this UK variant. But there's a couple others, one from South Africa, one from Brazil. There's a new one in California that we're less clear about yet. These variants are still more resistant to being stopped by the antibodies from the current vaccines. So
Dr. Johnathon Ross says we're going to be wearing masks, if we're smart, for probably months ahead.
Yes.
But with the potential of doing thousands per day in this county, folks, the supply is there, the access is there. We've come this far. Let's not blink. Let's not blink.
Good advice, Jerry. Don't blink. Do it.
Yeah.
Get the shot.
Get it done. My thanks to Lucas County Health Board President Dr. Johnathon Ross, keeping us on the leading edge of the COVID virus and the COVID vaccines, seeking to wipe it out. When I come back, the pandemic sure generated a lot of public health directives, right, from the governor and the state health director. Now lawmakers want their say, and this week they did something about that. We'll have that next on Leading Edge.